Okay, well, welcome. That's our cue to get started for today's session. Thank you for joining our IDRPP's Project Scope Echo. If you've not taken a minute, please put your name and contact information into the chat. Just helps us know who's on the call, helps us get to know each other. We are recording today's sessions. These will be stored on our Canvas page as well as our YouTube channel. So if you want to go back and watch those or share any of this information, they're always available for us. Renaming your profile, again, just helps build us up with that community, know who's on the call, what our roles are. So if you'll take a minute and rename your profile, if you need to ask a question, you can either raise your hand and we'll call on you, or you can put that into chat. And Kurt Phillips, one of our hub members, helps us manage that chat. And so he will ask your question for us. If you've never joined an echo session, we do talk about individuals. So remember to protect their individual privacy. Avoid using any first, middle, last names, mother's maiden name, social security, all of that wonderful information that we could identify somebody. So if you're unsure of what not to share, you can reach out to an hub member. They all have an asterisk in front of their name. A key component of an echo session is we will always have a didactic speaker who shares us some information, as well as then a case presentation with us all sharing some feedback. It really builds that knowledge, that professional community, gets us to know and understand what other people are doing out in the real world with these families. We are an interactive community, so ask your questions. If you feel comfortable, please turn on your cameras. It's really a great way to put a name with a face, even through this virtual way that we tend to navigate the world post-COVID. We also do case narratives. They are a great way to gather information from others on the call, as well as to share information or learn how to help a family that you may be struggling with. So consider sending in a case narrative. You can reach out to projectscope@usu.edu if you're interested in that. We give credit of attendance. So if you want that, we ask that you fill out our survey evaluation. Bailey will be dropping our survey in throughout today's session, as well as we will email it out at the end. We store everything on Canvas, so you will have an access to Canvas. If you've not received that, you can also email us and we will get you a request for that Canvas page. We share things on social media, information that we gather from others, as well as information about all of our project echoes, useful resources. So it's just another way to connect with each other. And if you want to take a minute to follow us, that would be great. I'm really excited to turn the time over today to Olivia Gruwell. I probably just hashed her last name, but I'm going to turn it over to her. She's going to share with us about the Safe Baby Court, and I will let her do some introductions. Thank you, Olivia, for joining us.
Thank you so much. And by the way, you nailed it. Most people totally destroy the pronunciation of my name, but you got it. The first time I ever pronounced it, I don't even remember how I did it, but my husband just laughed. My now husband just laughed at me. So it's not an easy one. But I like to try and visualize it. Like, I'm like, if I ever had a name tag, I'll put like Gru from Despicable Me on there, and then a well, because that's basically how it's pronounced.
That's a great way.
So I'm really excited to be here today and to be presenting about the Infant Toddler Court Program, otherwise known as the Safe Babies Approach, here in Utah County. We've been around since 2020 was when we started the program down here. It started kind of back in Florida in the approach, and now it's been kind of just spreading across the country. And it's been a fantastic experience to have it here and to have this resource for the families. So the Safe Babies approach, it looks at, oh, first, before I forget, I'm going to be using slides from the 0 to 3 foundation. And they're the ones who provide like all the training and the resources for sites that have this approach and program in their courts. And so it's just easier to use their stuff than to make my own sometimes. So we'll be using their slides today. So yeah, so I'm excited to jump in and get started. The Safe Babies approach came about because there was a visible need for families with children ages 0 to 3 involved in child welfare to get more specialized support as they were going through these cases. And so that's kind of how it came about. And it specifically addresses the needs of these families and these young infants and toddlers. If there's only one thing to remember from today, we want you to remember these two things: that the science is clear. Our brains grow faster between the ages of 0 and 3 than at any point other than that in our lives, any later point in our lives. And that when babies have nurturing relationships, early learning experiences, and good nutrition, those neural connections are stimulated and strengthened, which lays a strong foundation for the rest of their lives. So I'll be discussing the intentional systems integration that supports the crosswalk between child development and child welfare, and how we are transforming child welfare into the practice of child well-being using the science of early childhood development. Also, another side note, we are currently funded by HRSA, which is the Health Resources and Services Administration through the U.S. Department of Health and Human Services. And anything said here is not necessarily an endorsement by HRSA, HHS, or the U.S. government. So if you'd like more information about that, please feel free to reach out to me. The Safe Babies approach is driven by a vision of prevention where systems work together to strengthen the family, putting the need to protect and build safe, stable, and nurturing early relationships at the center of child welfare decision-making. For families involved in child welfare systems, this evidence-based Safe Babies approach ignites collective action in states and communities to strengthen families and meet the urgent needs of babies and toddlers. This brings the voice of parents with lived experience, and we bring the voice of parents with lived experience into all levels of the work. We believe that every child is filled with enormous potential, and that we as a community and as families have shared responsibility to support that development. So there's a reason why this matters. There's an urgent need for us to focus on these young children. Of the 7.2 million children in the United States referred to Child Protective Services, children under the age of 3 enter the child welfare system more than any other group. In fact, every 7 minutes, a baby or toddler is removed from their family due to child adversity and placed in out-of-home care. There's a lot of reasons for why we focus on babies, toddlers, and their families. One of our Safe Babies judges used to say, who says no to babies? But perhaps 3 of the strongest reasons why we focus on these families is that the rate and acceleration of the brain's development in that first 6 months is just completely unmatched. The neurological connections are already happening at birth, and by 1 month of age they have doubled and almost tripled by their 3rd month. And in the first 3 years of a child's life, their brain will grow faster than at any point in their entire lifespan, leading this to be a very key developmental stage for them. This time is critical because healthy and positive child development emerges best in the context of nurturing, warm, and responsive early parent and caregiver and child relationships when children are surrounded by safe communities with strong trust and social connectedness. Safe Babies, our infant toddler court programs, is a national support network that ignites collective action across systems in states and local communities to meet the urgent needs of babies and toddlers at the risk of removal from their families under court jurisdiction and in out-of-home care. Through a term-based approach, we are using the science of early childhood development to strengthen parent-child relationships and ensure every baby is thriving in a loving, nurturing, safe home. On the next slide, I'm going to show kind of a pretty a graph that it shows kind of the highest rates of maltreatment that I was talking about. So nationally, the younger a child is, the more vulnerable they are to maltreatment. The victimization rate is highest for children younger than 1 year at 25.3 per 1,000 children in the population of the same age. This is more than double the rate of victims who are 1 year old, which is 10.7 per 1,000. Further, children under 3 years of age make up more than 1/4 of maltreatment victims, about 27.8%. Children younger than 1 year are 15.1% of all victims of child maltreatment. So John Bowlby, one of the pioneers of understanding attachment in infancy and early childhood, said that if we value our children, we must cherish their parents. Through offering parents healing experiences, we can help them to create those secure, nurturing relationships that we know lead to later well-being for themselves and their children. How any parent cares for a child is highly influenced by their own past experiences, where they are in their own development as a parent, their expectations of their child, and the current stressors that they're experiencing, as well as aspects of their own temperament, personality, and cultural norms. As we think of families who encounter the child welfare system, we must hold in mind that they are highly likely to have experienced prior trauma and adversity themselves, which may pose challenges to engaging them in the work, not to mention their current stressors. This is the reason why Safe Babies uses a trauma responsive approach, which emphasizes healing experiences that strengthen parent-child relationships and build families' protective factors. By cherishing these parents, we promote well-being and prevent future poor outcomes. On the next slide, I'll have a little graph that shows a little bit more about the Safe Babies approach, a little more visually. So this Safe Babies approach is guided by 5 areas of focus, with the needs of babies and parents at the center. And I love this little image of the child being wrapped by the parent in the center of this wheel. The approach works concurrently at both child and family levels, as well as the state and site level, to ensure healthy childhood development while impacting long-term capacity building. At the child and family level, the work is about infusing best practices into court proceedings and the child welfare case planning process. At the community level, the work is about partners coming together to systematize best practices and engage in broader efforts to build a strong early childhood system for very young children and their families. And kind of what this looks like is that my role as the community coordinator is that I help facilitate our family team meetings with the families and any other professionals involved with the case, as well as on the side, I work to facilitate an active community team where I have representatives from organizations and individuals in our community who are interested and serve these populations and have perspective on these populations on what they're going through. And we come together and discuss those challenges and what we can do to kind of overcome those barriers, both on a local scale as well as on a larger scale. Our 5 areas of focus are enhanced oversight and collaborative problem solving. So we work alongside families frequently to foster a climate of collaborative problem solving with the family. Just the other day, I did a new intake with a family, and in talking to them, one of the things that they really appreciated was the fact that at our family team meetings, they are not hierarchical. We see them as equal team members with us and as the experts of their own families, of their own lives, and of their children. And we request that they come to the table as such, and parents really respond very well to that. The second area of focus is expedited, appropriate, and effective services. So we try to help make sure that if an assessment is needed or if a resource is needed, we help facilitate them getting access to that in a timely manner. The third area of focus is trauma responsive support. So we encourage looking at every aspect of our programming, environment, language, and values, and involving all staff to better serve participants who have or may have experienced trauma. And by doing so, we aim to prevent enacting more trauma on the family as much as possible throughout the process of the child welfare case. And the fourth one is continuous quality improvement. So we are always collecting data on how things are going and the outcomes and the resources that we're providing, and parent feedback is incredibly important so that we can continue to adapt and improve as the world adapts and improves and changes. And then the last one is interdisciplinary, collaborative, proactive teamwork. So this family, the parents, they interact with professionals, parent mentors, organizations that work collaboratively to better serve the family's needs so that they can find stability and healing. Central to the success of work is lifting up and giving voice to parent experience, which we do by supporting the development of parent leadership within the approach. Parent leaders are individuals who are committed to making positive changes in their family, community, and at the state and national level by using their experiences as participants in the child welfare system. That right now, because our program is so new, we have some parent partners at the state level that we work with, and at the local level we haven't gotten quite there yet, but that is kind of something that we are looking at in the near future, being able to involve some parent partners at more local levels. So how do we get to this big vision? We focus on the urgent developmental needs of young children during all planning and decision making to strengthen early relationships with parents and caregivers, and to create the safe, stable, and nurturing environments that babies need. We create a safer path for families to flourish and thrive by coordinating and aligning early childhood systems that serve, advance, focus, empower, and redesign. By serving as an entry point across early childhood systems to effectively serve families across various areas of need, and advancing well-being through providing professionals with knowledge, strategies, and tools, focusing on the baby's developmental need in all decision making, and empowering parents to share their voices and lived experiences. And then we work to try and use all of that we learn and gain to redesign any policies that we can and practices to address equity. By clear-cutting pathways to resources and supports for families experiencing disproportionate barriers such as financial hardship, adversity, and systemic inequities, we intentionally aim to mobilize policymakers and partners to advance policies that meet the need for babies, toddlers, and their parents and caregivers in the child welfare system and beyond. At the heart of the Safe Babies approach is professionals coming together in partnership across sectors to engage in collaborative and proactive teamwork. Kind of like I mentioned, we have our active community team that meets together. This teamwork depends on leadership and staffing that supports the shift away from doing business as usual and towards shared aims to advance the work, always keeping the urgent developmental needs of infants and toddlers today at the center of our decision making. In Safe Babies, this work is led by agents of change. With this in mind, we've rolled up our sleeves and got to work on the essential functions for the roles and teams in the approach, for the judge or judicial officer, for our community coordinator, for professionals supporting infants, toddlers, and their parents and family team meetings, and for partners coming together in the spirit of collective action in our active community teams. Our aim was to create operational definitions that are highly doable and that are also readily observable so that everyone can see themselves in the work and see how their role is critical. Part of my role as the community coordinator is to not only bring the right people to the table, but to appreciate them when they are here and for the contributions that they give, both for professionals and for the families and their friends and supporting people. On a family level, a key operational agent of change can be found within the identified members of our family team, which may vary by appointment from child welfare staff, assigned attorneys, and identified community service providers working directly with the family. Our family team meetings engage families in collaborative, proactive case planning that puts a young child's developmental need for safe, stable, and nurturing early caregiving relationships and the individualized needs of each family member at the center of our decision making. Professionals actively support parents' confidence and motivation, creating a climate of trust, compassion, respect, and transparency between the families and professionals. The case planning process includes transition planning, is family-centered, and employs a developmental, multi-generational lens to ensure that the needs of parents and family members can also be addressed. One of the really beneficial parts of this program is that in the typical child welfare case, parents will get 1 or 2 contacts with the judge every 3 months. And in this one, we actually have court hearings every single month. So if a parent gets off track, we very, very quickly get them back on track as we have a court hearing and then a family team meeting every month to continually be checking in with all of the professionals involved in the case. At the community level, the other key operational agent of change belongs with the community itself. Systems work at this level is mobilized through our active community team, which collaborates on systems change efforts that improves access to comprehensive prevention, early intervention, and therapeutic services and supports for families with very young children. The ACT identifies shared systems change priorities and develops solutions for policy, funding, and other infrastructure changes that are supportive of the Safe Babies approach. However, the ACT does not discuss individual cases. It's more of a let's see what trends we're seeing and how can we help, shift these trends in the direction that'll be best for the families in our community. Currently, Safe Babies has 124 sites across 28 states. Our site in Utah has been nationally recognized as a very well-functioning, high-functioning site. We have such a fantastic team here led by Judge Bazell, who is in our 4th district court, and she has been just a joy to work with. A couple weeks ago, I had a meeting with her, and every court hearing I watch what she does, and it's amazing to see how well she just is so empathetic and still holds good boundaries. And in our meeting, I was like, Judge Bazell, I just want to have the chance to just watch you all the time. And I was like, wait, no, that's creepy. Hold on. I mean, I want to learn from you. That's what I meant. So if you ever feel nervous about what you say to a professional, just remember that Olivia told a judge that she just wanted to watch her. So that was not my best moment. Right now they are expanding Safe Babies across the country, and there's been, like I said, a huge surge of people opening their Safe Babies and infant toddler court program sites because the evidence shows that this is so incredibly effective and at not only reducing the amount of time that these children spend in child welfare, but that many of these children end up getting to go home to their families rather than being adopted into other good families. So we're going to skip that because that's not relevant for us. So all of these drivers of change aim to make family and systems level changes to keep the baby and their family at the center in all decision making. This means continuously striving to create the experiences and environments for the baby that allows them to reach their great potential, holding in mind that relational experiences sculpt and influence the development of the brain, particularly in early childhood, specifically that experiencing disruptions in relationships threatens the baby's sense to safety and routine, leading to the release of stress hormones, which corrode the connections that help the child regulate their emotions and body. The very act of separating a child from their parents can create this toxic stress. And here we have a quote from a father who was involved in Safe Babies, and he said, "You have helped me take myself apart and put it back together. I'm all nuts and bolts. This has been a very well process for both of us. It took a long time, but it is worth it. And I didn't think it was ever going to happen." So I just want to thank you for letting me come and present today. Right now in Utah, we have 2 sites that are open. Mine here in Utah County, and then I have Christy Cole here as well, who is the Iron County Community Coordinator. They opened their site earlier this year and will start taking cases next spring. And we're just really excited to be here and be serving the families here in our community. Now, I guess I have time for some questions if anybody has questions, and I'd love to answer any questions. If you have any thoughts or questions about our active community team or would like more information about participating in that, please feel free to reach out.
Olivia, thank you so much for that information. I don't know if there are some questions that people on the call have that you can either put them in chat or just come off mute and go ahead and ask Olivia the questions.
Yeah, come off mute. This is Erica. Sorry.
Okay.
I missed.
Hi, Erica.
How are you? I missed how they get, so if they are referred to DCFS or have an active case, that's how they access you guys, or how do they access your services? I was unclear of that part.
Yeah, that's a great question. And I forgot to mention that. So, kind of how it works is that CPS will open a case, they'll investigate, an allegation. And then when a case is open, it gets transferred to DCFS. If we have an opening at the time for those families, then they are invited to participate in our program. Right now, as a community coordinator, I'm limited to working with 20 families at a time. That's my caseload limit. So that's where we are. Oftentimes we are full, but fairly often we have openings come up, and we try to get people in as quickly as possible when we do have an opening.
So, and then Olivia, they also asked if you would put a web address into chat.
For me, or do you want, because there's a couple of things. So you can ask for more information about Safe Babies. They have their own website, or there could be access to me and what we're doing here in Utah.
You clarified with the program ad.
Okay, yeah. Let me find that. Yes, I can add that. And I'll just put both. So 0 to 3 is the place that does a lot of the research about the approach, and they provide the training for what we do and the support. And then the Children's Center Utah is they are who organize and run and hire people like me to, give this approach here in Utah.
Any other questions or comments for Olivia? Okay, it says, do you work under an agency, or are you independent of all agencies and collaborate?
So I work under the Children's Center Utah, and they are completely separate from everybody else that works involved in child welfare cases. So we even our location is up in West Valley, and I work remotely in Provo with the attorneys. And I mean, that's kind of the role, kind of the goal is that the community coordinator is a separate entity that a neutral third party, that's the word I was looking for, kind of a neutral third party that brings together all the other professionals and members in the family team, kind of to help level that playing field, so that families feel more comfortable bringing in their things, as well as other professionals feel more comfortable, and there's no other challenges that way. Is Safe Baby, does that answer the question for that?
She's shaking her head, yeah.
Okay. Is Safe Babies looking to expand into other states? They do, honestly. I don't work for Safe Babies or 0 to 3, so I don't know what they're doing, but I actually have a lot of other states. So I have a contact in, I think it's Missouri, as well as one in Arizona, that they have been shadowing me and working with me and opening their sites. So it's currently and rapidly expanding, and I do a lot of national collaboration with different places that are starting to try and implement Safe Babies or an infant toddler court program in their area. Yeah.
So Olivia, I have a question while we're waiting. A lot of us are early intervention providers from Part C agencies. How can we work with Safe Babies Court to coordinate families or make that referral?
Yeah. So are you meaning referrals from our Safe Babies that are currently here, or for you guys to refer people to us? What is kind of that question?
Kind of both of that. How would we what are some of the families that we may refer to you, or if we know that a family is working with you, how do we just better support some of those?
Yeah, that's a great question. So, I mean, when it comes to referring to us, the only way I could see that working is if like you know a family that has a case open, and before, like, it has to be really fast. I mean, we have to work really fast too in like saying, hey, I know this family. Reaching out to Megan Felsh is the supervisor for our at DCFS for our Safe Babies caseworkers. So letting her know like, hey, there's this case coming in, and then we could try and see if we have an opening to bring them in. But for how to support the people we already have, one of the best ways would be like reaching out to me, reaching out to Christy, depending on which area you're in, and participating in our active community team, or even presenting at our leadership conference, our Safe Babies leadership team meetings, so that we can know what's going on and what's services you offer. And we do try to partner with as many local community partners as possible so that we can send referrals over to you guys. So just kind of getting in contact with us and making us aware that you're there. I mean, part of my job, I spend quite a lot of time on Google, and I look through like the Excel sheet of all nonprofits registered in Utah to be like, who's out here? Because it's kind of hard to find it sometimes, and reaching out to everybody. But if you want to cut me some slack and reach out to me, that's super helpful too, and kind of streamline that. And I'm happy to have people present at our leadership team meeting, as well as sit in on our ACT. Our first ACT meeting is actually next week, I believe, on the 17th at noon. We're just getting that started. So and they're all virtual, everything we do. So it's kind of an exciting time right now for Utah County, because we've been providing these services for a long time, but we're streamlining it and coming together now. So that's pretty cool.
Yeah. Oh, that's awesome. And then there is also a question on where will the Iron County office be located?
So I don't believe we're going to have an office in Iron County right now. Christy Cole is on the call here, and she can answer a little bit more. If I err, Christy, let me know. But right now they've been doing a lot of work at meeting at like the courthouse and things like that when they need to have in-person meetings, and there's other places they've been looking into. Iron County's site just opened in August, so they are brand new and still putting things together. And I think it's still very much in the developmental stages, and they'll be starting to take on families come this spring or summer.
Great.
We will be building a Utah County location within the next 4 years. We have a grant that will allow us to be doing that. So that is something that should be opening in Utah County pretty soon. And as Iron County grows, I wouldn't doubt that they'll look at that down there too.
That's fantastic. Any other questions that anybody has for Olivia on our call? Okay. Thank you, Olivia, again for joining and sharing with us information about the Safe Babies Court and what you guys all do. I am gonna stop talking again and turn this time over to Bailey Campbell, who is going to be introducing our case presentation today.
Okay, let me just get it up and going. Oh, I think it did the wrong. Okay. Did that pop up right? Oh, right now.
On my end, I now see a blank black screen.
That's not good.
It popped up for a minute and then
And then it just disappeared. The problem is I have 3 screens open and I don't know how to have a new, sorry.
You could try stop sharing and
Okay, start again.
Do it again.
Okay.
We all love technology at times, right, everybody?
And I swear, no matter how many times you do it, it still doesn't work, or it still goes wrong. Okay. Now where's my screen one? Maybe I should have practiced before we did this. Is that on the right screen?
Yep. So far.
Okay.
I don't know what's going to happen once you pick. Okay, switch it.
Okay. Oh. Did it do it again?
No, but so if you do from beginning, share screen from beginning.
Is it doing it? Oh.
No,
Resume slideshow. How's that?
it didn't change.
Oh
So
my.
you could just go through it right here, Bailey.
Okay, I'll just read it.
Okay.
Sorry, guys. What kind of an Echo assistant am I? I can't even get the Zoom to work for myself. Anyways, okay. So this is a case. I'm not a provider, and it's not a real case. We kind of made it up based on experiences that a lot of providers interact with and have. So this kid is a 25-month-old child and has been living with their current caregiver since they were 10 months old, which is their aunt and uncle. And the caregivers have very limited details on the child's history before they took custody. But it was their niece is the mom, and she was reported to have a substance use disorder, used methadone and marijuana during the pregnancy. And the baby tested positive for both at birth, but had no significant withdrawal symptoms. And the mom left the hospital abruptly without the baby, and the child was placed with her relatives. And she kind of bounced around between homes until her great aunt and uncle agreed to be the permanent guardians when she was 10 months old. So she's been living with them for about 15 months. And they have since accepted the child's biological brother, who was born a year ago, and came straight home to them from the hospital. And the mom is currently incarcerated. So the primary concern is that the girl, the daughter, is aggressive towards her little brother and towards the family's dogs. And she'll put a blanket tightly over her brother's face and kind of press it down and pull his hair, pinch his arms and legs, and just be a little aggressive. And then she also kicks and hits the family dogs and is aggressive towards them. And she also, when she doesn't get her way, she stands and screams and will clench her fists. And there are sensory issues. The great aunt and uncle said that there are sensory issues, like she doesn't like it when her hair gets wet, and she seeks tactile input for pressure and touching and all that. And then one of their biggest concerns is that she has frequent fecal smearing, which usually occurs when she's in her crib, but also happens in other settings. And so her common triggers and stressors are when she doesn't get her way, when others are getting attention and she's not getting the attention, when she isn't understood because articulation is an issue, and then also sensory issues. So the strengths are that the providers were able to complete a developmental assessment, and it revealed that motor, communication, and cognitive areas are in the average range, and social, emotional, and adaptive areas are below average. The child was really friendly and easily engaged during the evaluation, and the great aunt and uncle seemed to be very loving and supporting as caregivers, and they're great advocates for the child. So her great aunt and uncle are a good support system and want to do what they can to help. But the biggest barrier is they live on a farm in a very rural area. And they're about an hour away from the next biggest city, so access to services are challenging. But the goal with this discussion is that we'll be able to provide these caregiver strategies and interventions to address the behaviors that are affecting the family from functioning and to help this child meet her full potential. I guess I could have just showed this from the beginning, but the main questions we have 3 questions. The first one is, what strategies can caregivers employ to address the fecal smearing and aggression towards her brother? These are the 2 things that the caregivers were most concerned about. So that's the first one. The second question is, any ideas on self-regulation and sensory interventions that might be helpful? And then the last question is, what community supports or self-care ideas can we recommend to this older retired couple, the aunt and uncle, because they love the kids very much, but they're exhausted, as parents are. So those are the 3 questions. Does anyone have any follow-up questions before we go to breakout groups?
So Kurt, I'm going to have your group take on question number 1. So the strategies that caregivers can employ to address that fecal matter, as well as maybe also some self-care ideas. Then Tiffany Warwood, you were on here. Yes, I still see you. I'm like, and my screen jumped. I'm going to have your group, if you guys will answer that ideas on self-regulation and sensory interventions. And then Kelsey, you and I will be in a group together, and we're going to take that number 3, the community support. So again, we're going to do breakout groups. If you'll take a minute and turn on your cameras and do some self-introductions, where you work, where you're from, and then we'll dive into the questions that our groups are talking about. Bailey, are you ready to put us in breakout group?
Yes, I'm just making sure that they are all equal. Okay, those should be open. You can go ahead and join. And Janelle, you will join group 1.
Okay. Again, if you'll take a minute to complete our survey, that would be great. We're going to just quickly go through one idea from each breakout group. So my breakout group was Sherry. Sherry, do you want to share one idea from our group? I know we had a ton of good ideas.
Yeah, so many. I don't know how to pick just one, but say for fecal smearing, we said to limit access to the diaper by either backwards close, double layers, and then also replacing that behavior with an appropriate sensory seeking behavior.
Fantastic. Tiffany, I don't know who you had your group do.
We talked about self-regulation and sensory intervention, but
Okay.
One of the main ideas that we focused on was self-regulation, and that you can't expect a child to be able to just self-regulate. It has to be a co-regulation. You know, the parent has to be involved in helping that child learn the skills to self-regulate, you know. So if it's deep breathing techniques, that parent has to be willing to sit with the child and do the deep breathing and teach them what it's like. And it's not something that comes easy, and it takes time, you know. And so just focusing on that, you know, just being able to understand that you can't expect your 1-year-old to sit down and, hey, do some deep breathing, and then to just be able to self-regulate. It has to come from a co-regulation.
Yep, I love that idea. All right, Kurt, your group is up next.
We didn't have any ideas. We just talked about other stuff.
Sweet.
I'm just
What was one other thing you talked about? I guess
we had
you were the slacker group.
Well, they're led by me. So what do you say? What do you think? We actually had some really good ideas. We talked about the kind of the self-care for the aunt and uncle, as well as for some of the behaviors with the kid. One of the things I thought was really good, a lot of it kind of circled around the rural nature of where they live and how services just aren't available there. And we had the idea of coming up of, you know, a lot of times in the rural area, there's a lot of nature you can go out and get around, and how kids tend to love that. Is there a way to kind of structure some time to get out on a regular basis outside? We talked a little bit about how sometimes we feel judged because our kids aren't behaving perfectly. And so maybe is there someone that could work with aunt and uncle to help them understand that just because your kid's throwing a fit doesn't mean you're a bad parent. So that shouldn't keep you from getting outside and spending some consistent time outside so that we can get the kids out where they want to be, get us some fresh air as caregivers, and hopefully have some mental as well as emotional, I guess, normalcy.
Well, great. Those are all fantastic ideas. If whoever was the note taker from your group, if you will send those to bailey.campbell@usu.edu, she's dropped her email into the chat, we will compile those, and they're always going to be on our Canvas webpage. But if you were the case presenter, you would get a myriad of amazing resources. So please consider sharing a case with us at any of our future sessions or any of those. So next month, we will be having our session on November 13th. So please join us for that, and we will see you for the next time. So enjoy the rest of your day. Thank you.